Well, hello there, surgical technology students. I'm sure you've missed my face. I've missed yours too. Just wanted to do this quick little YouTube thing for you and, just to sort of see if it works. Keep it kind of general. For today, I'm sitting out on the back porch of my humid home in Palm Harbor. I like to work out here. Just real quickly, go over a few things. I'm sure we've pretty much gotten settled in now to online learning and doing online assignments, and everybody's doing a pretty good job with that. Congratulate you on that. I know you're dealing with kids and various other distractions, but every day from 8 to 11, Monday through Thursday, we're trying to keep it like it was. Classroom work, concentration on your studies. All of these things prepare you for the CST exam. These online assignments actually I think are pretty good. They go into pretty good detail. So keep doing the best you can on those. Go into detail on the questions and you'll learn a lot. We found out a lot of things about some people. We found out that our student Chad is an artist. He is currently working on something for the Clearwater newsletter, some artwork. I'm also going to have him work on drawing a scene for an operating room, which would have a surgical technologist assisting the surgeon during surgery, and hopefully we can get this large enough to where we can frame it. He can sign it. We can put it on the wall outside in the hallways of the classroom with all the other framed photos we have. We like to celebrate accomplishments. We like to celebrate special stuff that our students do. So we kind of found that out about Chad, and I think he's agreed to do some of this. We've got plenty of time probably on our hands. Some of us do. So, but hopefully you're finding out during this time, you're finding out some things about yourself and some of the ways that you handle stress, maybe. Ways to handle your kids. You should maybe hopefully you're teaching your kids some things while they're not in school, if they're old enough, how to cook, how to keep their room straight, how to wash clothes, things that we all learned in the past, but we kind of get away from because we're too busy. But every time there's a tragedy or a catastrophe or some type of negative event like this, the people who are leaders find out ways to improve, find out ways to make things better. We could blame things, we could get negative, but what does that accomplish really? We want to get better each and every day. The hospitals need quality people. I don't think there's been any instances of any hospitals furloughing any of our graduates, our students that are working now, any of our alumni students. They all seem to be reassigned or doing something else to help out, so that speaks to the quality of our graduates. Hospitals have had a rough run here with their PPE, just having enough equipment to provide for the people who have to deal directly with COVID-19 patients. It's been interesting to see how the public has dealt with this. We know more about PPE than just about anybody else does because we live in PPE in our jobs. We know we've taught you how to put it on, how to scrub, how to put it on without touching the outsides. We've taught you how it gets contaminated and how to recognize that and what you have to do to fix some of those problems so that you can continue on because surgery goes on. The surgeon is standing right there. They are impatient. They're demanding. They expect excellence and perfection. But we also have the ability and the responsibility to stop a surgery so that a contaminated glove can be replaced if a surgeon accidentally contaminates his glove, because it's all for the good of the patient and for the good of the liability for the hospital. So it's a hugely responsible job, and I know you've all thought about this a little bit, about how we wear PPE a certain way. We do it, largely to protect ourselves. We never quite know. No matter what the patient has disclosed, we never quite know what they have in their blood, what they have in their bodily fluids. We deal with that. We deal with those bodily fluids and blood and the sponges that we use, the suction that we use. And so we protect ourselves, we protect the patient, we protect the liability of the hospital, we protect them from infections for the patient. So it's a hugely responsible job that we do, and you should be proud of what you've chosen, the career you've chosen to enter. There will always be a need for it. Word is that as soon as the COVID-19 episode is at a point where surgeries can pick back up in the ORs, that all those elective surgical cases that were delayed or postponed will start flooding the ORs. So one of the things we try to do in our career is we try to think ahead, we try to anticipate, and then we try to plan so that we can, I'm not used to talking this much. So that's kind of our job. Anticipate, think ahead, anticipate, plan, be ready. The surgeon needs us to do that. And so now we're our graduates out there in the field are thinking about that now, because they're going to be literally flooded once the public calms down and becomes more assured that things are okay, that they'll be doing all those surgeries that were put off, and the surgeons will be trying to recoup that income that they lost too. So anyway, lots of things are going to go on. We never have the hospitals complain about our students. That's one of the good things that one of our students mentioned in her, I believe it was in the discussion, or maybe it was in an assignment, that one of the good things about the Kaiser program is hospitals never complain about our students. They actually want more of them when they can get them. So we try to train you the right way. Sometimes it's hard. Sometimes you don't like it. Sometimes we don't like it. But we do it for a reason. We do it to get you ready, because that's the bottom line, is that you're ready to go. So that the surgeon will say, after he's worked with you in clinicals, we want to hear the surgeon say, as they have in the past, "You mean you're a student? I thought you were an employee here. I thought you were a new hire." So that's what we like. Anyway, keep up the good work. Keep doing the online assignments like you're supposed to, and on time, every time. Preparation is everything. We like to have a standard of excellence. That's the way our lives are. We just have a standard of excellence in everything we do, whether it's an online assignment, whether it's a clinical, whether it's a case assignment, no matter what it is. Excellence. That's what it's all about. Then you get to call the shots in your career, because people notice. People notice when you're absolutely excellent in what you do. So keep up the good work. I'm going to end this video now and see if I can hopefully get it to YouTube. You can view it, and then if it works, in the coming weeks, while we are safer at home, maybe we can do some more of these on a little bit more instructional basis. Okay? All right. Stay safe. Take care. And we're all going to be good, okay?